Today we will very briefly see granulomatous inflammation. What is granulomatous inflammation? It is a distinctive pattern of chronic inflammation only. Okay. Now, what is a granuloma? Granuloma is a cellular attempt to contain an offending agent that is difficult to eradicate. So it tries to contain that agent. Okay. So that is granuloma. Now, how does it appears in the morphology? If we see the morphology, the granuloma is nothing but microscopic aggregation of activated macrophages. Okay, and they're surrounded by the mononuclear cells. Okay, so in the center we'll find the macrophages. Okay, and surrounding we will have the mononuclear cell infiltrate. Now, some of these macrophages may get activated to form epithelloid cells. Epithelloid cells means epithelial-like cells. And then some of these epithelioid cells can form giant cells like this, multinucleated giant cell. Okay. Now, epithelioid cell, how does it look? On HE staining, the epithelioid cells will have a pink granular cytoplasm with indistinct cell boundaries and appear like merging into one another. The nucleus is less dense than that of a lymphocyte. So the morphology will be in the center there will be activated macrophages, okay, or epithelioid cells or giant cells, and they are surrounded by the mononuclear cells. The epithelioid cell, they have indistinct cell boundaries and they appear like merging into one another. Okay. Now let us see the types of granuloma. Granuloma could be a foreign body type granuloma or could be immune granuloma. Now, a foreign body granuloma is because of an inert foreign body. Now, since it is inert, there will be absence of any T cell response to this body. The epithelioid cells and giant cells are arranged around the foreign body. Examples could be talc, suture or silica. There is no inflammatory or immune response, and on polarized light we can see refractile foreign body. Okay. Now, if we talk about immune granuloma is caused due to persistent microbe infection or due to self-antigen. Okay, now immune granuloma can be of two types. It could be infective or it could be non-infective also. Now, infective, the examples are tuberculosis. In tuberculosis, we specifically see caseating granuloma with Langhans giant cell. So, caseating, if you can draw it, we will see the caseating necrosis in the center. And then in the surrounding, we can see these giant cells, Langhans giant cells, and then the surrounding will be mononuclear cell infiltrate. Okay. Then cat scratch disease, we see stellate shaped or round shaped granulomas. Syphilis, we saw gamma. Then lymphogranuloma inguinale, then brucellosis and leprosy. So these are the examples of infective immune granuloma. Now, non-infective could be sarcoidosis, inflammatory bowel disease, only Crohn's, Wegener's granulomatosis, rheumatoid arthritis, berylliosis, and Hodgkin's lymphoma. So, this is all about granulomatous inflammation. It is nothing but a subset of chronic inflammation only, and it is of two types, foreign body or immune granuloma. Immune is of also two types, infective or non-infective. Non-infective is usually autoimmune causes like sarcoidosis, etc. Okay, so this is all about granulomatous inflammation. Thank you.